Good day, Wonder Nurses. I'm Nurse Anne. Today, I prepared nursing exam questions for you to answer, and then I will provide the correct answer after 30 seconds. To make it special, we will also have a short discussion about the main topic of each question. So if you're ready, let's start. Question number 1. The correct answer is letter C. Let's talk about endotracheal tube. It is a flexible tube that is inserted through the mouth into the trachea to assist the patient to breathe. The other side of the tube is connected to a ventilator that delivers oxygen into the lungs. The duration of this artificial airway is only for short term. The average period is 1 to 2 weeks after the intubation. The endotracheal tube has a cuff that can be seen in the distal end of the tube. The cuff serves as a seal between the tube and the trachea. The ideal cuff pressure should be enough to seal the trachea but does not impede the tracheal mucosal blood flow. The cuff pressure must be between 20 to 30 millimeters of mercury. Question number 2. The correct answer is letter B. Chest tube thoracostomy or CTT. It involves inserting a hollow tube into the pleural cavity to drain fluid or air from the lungs. Always maintain a septic technique. Indication for insertion. CTT is used to create a negative pressure in the chest cavity and to allow lung re-expansion. It helps to remove air, blood, fluid, pus, or chyle from the intrathoracic space. Chylothorax is the accumulation of chyle in the pleural cavity. The word chyle is derived from the Greek word chylos, which means juice. Indications for CTT removal. If the drainage is less than 200 ml in a 24-hour period, the lung has re-expanded, and the patient's clinical status has improved. The removal is done by the physician, and it is important to instruct the patient to perform Valsalva maneuver during the chest tube removal. It helps in preventing the entry of air into the pleural space during removal. Question number 3. The correct answer is letter D. Tracheostomy tube. It is used to administer positive pressure ventilation, to provide a patent airway, and to have an access to the lower respiratory tract for airway clearance. Tracheostomy. It is a procedure that creates an opening on the neck to insert the tube into the trachea or windpipe to facilitate the patient to breathe. The duration of the tracheostomy tube is more than 14 days because it is for long-term use compared to endotracheal tube. It is indicated to patients with medical conditions that affect their breathing. Main parts of the tracheostomy tube. Outer cannula. It is the one with the flange or neck plate that rests against the patient's neck. This holds the tracheostomy open. Inner cannula. It is the true airway. It is the part that is being removed and cleansed. Therefore, it must be secured into place properly after cleaning. Lastly, obturator. It serves as a guide when the tracheostomy tube is inserted. It must be kept on the bedside in case the tube will be dislodged. Going back to the question, letter D is the correct answer. When the tube accidentally dislodged, the initial action must be to grasp the retention sutures to spread the opening to provide a continuous airway for the patient. Then call the physician and not the respiratory therapist to reinsert the tube. Covering the site with dressing will just aggravate the patient's condition. Question number 4. The correct answer is letter C. In assessing the patient with febrile episodes, we can inspect if there is any flush skin, and we can also do palpation to feel if the patient is warm to touch. Question number 5. The correct answer is letter B. Our last topic is patient-controlled analgesia, most commonly known as the PCA. It is a method of controlling the pain by giving the authority to the patient to control the pump to administer the medication. The goal of the pump is to keep the pain of every patient at a level that they can tolerate. Here are some of the terminologies that we need to know. Basal dose. It is the dosage of medication per PCA administration. Bolus dose. This is the extra dose. The dosage that the patient can administer when the pain increases. Lastly is the lockout period. This is the maximum dosage that the device can administer at a particular period of time.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.